company was selling drugs off-label to children.
Part of the explanation was the words business decision.
Get Gardasil and your daughter will be one less victim. In reality, she was never going to be a cervical cancer victim.
I was told drug companies write checks to both sides of the aisle. Back off.
What we see today is frightening. We've gone from looking at things scientifically to looking at what's best for the industry.
We've tripled the numbers of doses of vaccines we're giving our children. We have seen this increase in chronic immune and brain dysfunction.
The multi-dose flu shots still have mercury in them. Why would anybody want to inject something into their system that has viruses that have been attenuated or weakened?
We have a pipeline of hundreds of vaccines. It's a $30 billion a year industry. The government has said they're safe and effective for everybody. Now, the evidence doesn't suggest that.
The policy comes from government, and where does the government get their data? From the people who make the drugs or the vaccines. That's dangerous.
Do you trust that your doctor knows what he or she is doing and that the CDC is doing this job? All this garbage is not stuff that we were thinking about.
Just because you question something doesn't mean you're opposed to it. It means you want more evidence to support the position.
Genetically modified food is the next big thing for shareholders, for investors, for the industry. It is one big experiment that the industry wants you to be part of.
All of these diseases are matched with the use of Roundup on GMO corn and soy.
The number one argument we heard was that labeling would confuse consumers.
Just the idea that we shouldn't label something what it is because people might not buy it if we do. It's horrific, it's unethical, it's sickening.
Without a label, there's no traceability, there's no accountability, and there's no liability. And that's the way the chemical industry likes it.
The no side had such a huge tide of corporate money behind them, and the measure to label genetically modified food appears to have failed in Washington.
GMOs are banned in multiple countries across the world. Of course, we created genetically modified food, so are we going to ban it here? Of course not.
The FDA has let us down. They failed us. Their whole job is to ensure that our food supply is safe. They're relying on tests that are done by the very industry that stands to profit.
Diabetes costs our federal government $279 billion a year. $514 billion is what is spent on all of our health issues combined. This is an attack on our children.
Where there's smoke, there's fire. There's enough smoke in all of these things to be able to say, wait a minute, let's stop and reassess and re-examine.
Thank you all for coming out this evening. Last time we had a lecture out here was snowing pretty bad, so we had low attendance and all that. The roads were pretty rough. Our video recording crew got here a little late from Flint and all that. A lot of estrogen out in the crowd as expected this evening, which is good. I had one of my male patients the other day ask me, hey Jeff, Dr. Jeff, when are you going to do a male lecture? I go, well, Tom, you know, a bunch of the males that come to my practice here act like a bunch of females, so I decided to lump you all together tonight. But if I had to do a male lecture, I'd probably label it addressing common male complaints versus conditions, because they tend to complain a little bit more. With that being said, though, for the guys who came out this evening, props, I'll give you your man card here. It's going to be a great lecture. I put a lot of stuff together here for this lecture. Probably should have broken some parts down. In the future, I probably might break some of these different parts of the lecture in further lectures to come here, especially the thyroid component. Once I get to that, you'll kind of explain or see why. That movie was bought. That should be coming out eventually. I'm keeping that on the horizon. You will see that on the Facebook posts, newsletters, blogs, whatever. You will know when I know. And that was the same makers of the movie Doctor. And we had a popcorn movie night here. And I get my hands on that DVD. We'll probably doing the same thing here, a non-GMO popcorn night and movie night there. Just had to emphasize that because I had some people concerned. That GMO, yeah, we preach so much against anti-GM food here that we're going to serve you guys GM popcorn with the movie here. My September lecture, Inside Your Brain, an advanced lecture on brain health. I'm going to put a lot of great stuff together. I'm going to be talking about Alzheimer's issues, heavy metal issues in the brain, aspartame, NutraSweet. I'll be talking about the concussion issues with athletes. I'll be going through a lot of cool things as far as brain health goes, A lot of the stuff will also be based off of Dr. Russell Blaylock here. A lot of good stuff that I'm looking forward to that. It'll be the end of September there. I can only book this room out 2 months in advance here, so I can't give you the exact date, but I normally tend to shoot for the last weekend in September. Following tonight's lecture, I always like to give you guys an extra 10 minutes to questions and feedback and whatnot there for you guys coming out here this evening. And I've got coupons for put money off on your first visit to get you in the door if you guys would like to have those here too for coming out this evening. You can find our lectures on YouTube. You go to diversehealthservices.com, click the YouTube link, it'll take you to all our lectures there. Check out our website, diversehealthservices.com. We've updated some things there. Got rid of the newsletter. We've got onto the blog. This has been a lot easier for our patients to access. Go to our website, click the blog, and get right into that there. It's just a pain about that newsletter. The blog has been very easy to access. If you want to follow it, you could click the follow tab and it'll put your email in. And anytime I blog about anything, it gets sent right to your email there. And I've been tracking statistics on this stuff. It's been pretty cool. This has only been up since, I think, February, so a few months here. These are all the different countries our newsletter is going to here. It's very cool with their tracking device here. This blog in our office is well known. I couldn't, and this was a crappy picture. I screenshot this thing. I couldn't even fit it all in here. It's still going here. All the other countries here too. Very cool where people are searching for health things here and different approaches to their health. You can find us on Facebook there, whatever your niche is and whatnot. I hop on Twitter here once in a while too. News travels faster on Twitter, interestingly enough there. But whatever age range you're in, you might have different social media outlets. I try to connect to everyone there. We Skype with patients there, follow-up appointments, new appointments there. It's amazing with the, we got these YouTube clips and videos up here for our patients. We didn't expect this thing to just blow up and go everywhere the way it has. We've had new patient appointments from Australia, New Zealand, Europe, in different areas. Very cool, and all across the U.S., different areas. Very awesome. And I'm starting with a lady who's going to be up. This is from California, 49-year-old ICU nurse, female. She's dealt with chronic fatigue for 17 years. She's from California. She was talking about trying to come up for this lecture. I'm going to give her a shout out here because she's actually coming up in 2 weeks all the way from California. She's excited with the results that she's had with our office here and just adjusting things that have just been mismanaged for years. And I give her props for approaching her health from a different angle, being a nurse, because I know this from a standpoint with my mom being a nurse. The first thing you want to do is treat everything like a chemical deficiency. She had chronic fatigue for years. I rambled through some of their history there. As soon as she started saying, some of the autoimmune factors there, but also the EBV, the mono component, I knew exactly where to go. My patients, the chronic fatigue syndrome, the fibromyalgia, all kind of fall in this category here, but they get lumped in different things here when you don't know how to properly address these things. This has only been a few months. She's dealt with this stuff for 17 years. A few months later, 2 months later, I should say, 50% better with her energy. Still have some other things to work on, but she's turning the corner very good, and she's very excited with things that we're doing with her. I'm not even muscle testing her. We've seen some of this stuff so often, we know how to address these things. I had a same patient like this from all the way from Texas. She's got lymphoma issues. The first time I asked her, when did you have mono? And she said, when I was 17 years old, same thing with her. She's like, I don't want this stuff to recur. I'm like, you got to address the cause of that issue, why the lymphoma came first. If you've had mono, that's very well known to push into lymphomas. You block your liver with certain medications. Right now, people are going to block their livers with antihistamines. Antacids will block your liver. Issues with antidepressants, all your NSAIDs, ibuprofen, Motrin, Advil, Tylenol, you block your liver, block that immune system, you will spur cancerous growth, and you're trying to recover from cancer stuff, block that liver, and that will not happen there because When she blocked her liver with things, or anyone blocks your liver with the medications, you give life to that mono that lives in that liver. Milk and ice cream feeds bacterial things. If the virus lives in the liver, arginine irritates the viral people, but you block the liver where the virus lives at, you give it life. It's as simple as that. I decided to just lump all in one category here. Fibromyalgia, chronic fatigue syndrome, I don't know, hypersomnia here, wanting to sleep all the time. Some of my patients that sleep 10, 12 hours, wake up and they're still tired. They're not running the right panels. This viral panel here is how we approach these things here. And you get a copy of this at our office here too. But these are old infections that haven't been dealt with properly. I feel bad for the females here. I'm sincerely ashamed with how they're treated, because when I hear their stories, I went to my doctor, I'm tired, I'm fatigued, they're running all these test scans, this and that. Everything shows normal, everything shows normal. They're running the wrong things, everything shows normal. So what do? They turn us around. Everything on my stuff looks normal, but you look depressed. You need Zoloft, you need Xanax, you're not sleeping, storing some Abilify. And about the time they come to me and they're on all these medications, the more medications they're on, the harder it is to pull them out of this hole. The faster I could get them to getting on the right stuff without those medications, the faster their body responds to being put on the right things here. Dr. Tense, the exploding autoimmune epidemic explains a lot of this here, and most of you guys have seen this here. You get sick through your nose and your mouth. Your nose and your mouth. When you inject things in your bloodstream, foreign animal DNA protein, live and dead viruses, it turns on things in some people that you don't want to turn on. If you're lucky, it's just allergies. If you're unlucky, it's cancer, it's lupus, it's autism, it's this, that, many names for it. Just had a new patient in 2 Fridays ago. They just had a baby, adjusted the atlas, had some colic issues, pushed on the stomach there with the hiatal hernia stuff. Baby calmed down, fell asleep right after having that all done. She's like, we got hackled for not wanting to do the vaccines in the hospital and that. But what they don't know is my husband works for Pfizer. He's a biochemist, he works for Pfizer. He's the one who puts all this stuff in the vaccines. No one there in his department vaccinates their kids. What do they know that maybe you guys should know? Something to think about there. More about the energy component, and I'll be addressing a good bit of the adrenal thyroid stuff here today, but my other lecture, Fighting Fatigue in a World of Stress, I address a little bit more of those chronic old infections there. This here, I do not see around in the crowd. This is a pretty cool home run here. 49-year-old female here. She had precancerous cells on her cervix 12 years ago. They did cryotherapy on it. Last year, they popped back up again there. Her OB and her oncologist were like, the heck with it. Let's just cut you open and just tear up all your insides and be done with this stuff. She came to me and she got very good results for 2 reasons. She gave me time and she gave me compliance. I grew this stuff out of her using some pretty cool supplements. And I got rid of that yeast infection on top of it. She came back, all her pap smear stuff came back normal. And it was interesting because her OB is like, neither the OB or the OBGYN, or the OB and her oncologist have never seen anything like this reverse itself. Her oncologist was very interested with what I did with her. Her OB could care less, of course, unfortunately. And we're addressing other things here. You look at allergies and allergic to 23 different foods. You know what that screams right there? Low hydrochloric acid, low stomach acid issues. The definition of an allergen is an undigested protein. You need acid to digest your proteins. So that's where you take that to the next level with the next visit here. Gardasil. Dr. Diane Harper says young girls and their parents should receive more complete warnings before receiving the vaccine to prevent cervical cancer. Dr. Harper helped design and carry out the Phase 2 and Phase 3 safety and effectiveness studies to get Gardasil approved and authored and published and all the papers on this stuff. The one who tried to get this stuff out here is telling you, you know what, maybe you shouldn't. And YouTube viewers, if you're on YouTube and stuff, go on YouTube and YouTube Gardasil victims. These young teenage girls with these side effects and having issues with this are telling you their story that you're not going to hear in your local news. And there's something that with patients that deal with HPV and cervical issues here that I ask one question right off the bat, and I'll get to that here. So, Senechal Incorporated informed that the FDA, despite of all Merck's statements claiming that Gardasil contained no viral DNA, Dr. Sin-Heng Lee had discovered that there was indeed fragments of viral DNA components in this stuff. These things turn on things you don't want turned on. You get sick through your nose and your mouth, inject these in your bloodstream, kind of playing Russian roulette. Some of my older lectures, I've showed cancers turn on people from going to Africa, getting travel vaccines, missionary stuff, you know, with these types of things that they've been putting in them here. Here's the research. This is what I ask all my patients that have issues with this stuff. Are you a smoker? Most girls who smoke are on birth control will deplete their folate B12 levels. If you're folate B12 deficient, you will be more prone to having issues with the HPV than other females there. Birth control, I love this. Everyone, all these young girls, all their OBs are trying to push them on birth control. Oh, my period's not irregular, put them on birth control. Oh, I got this going on, birth control, birth control, birth control. Side effects, heart attack, stroke, embolism, cancer, DVT, blood clots. I had one of my good buddies, now fiance, 27 years old, had a clot from her birth control in her chest. Everyone missed this stuff and blew her off as having anxiety because they couldn't find the clot on her. Ran her through all these tests, scans, Holter monitors. I believe 3 to 4 cardiologists completely blew past this and was trying to just put her on anti-anxiety medications. My muscle testing and stuff, her blood clot reflex was weak. Muscle testing, everyone, you know, it's very intriguing. If I had time tonight, I'd show you some of the muscle testing stuff, how I pinpoint that there. But I told her, I'm like, you're the youngest person I've ever seen this on. I could guarantee you one of 3 things: birth control, smoking, and maybe a clotting factor issue on top of it. She said yes to smoking, yes to birth control. She didn't know about the clotting factor issue because that'd be more of a blood work thing there. 5 days after dealing with this thing for 2-3 months and 3 cardiologists missed this, I dissolved a blood clot out of her chest, $60 worth of supplements. Very intriguing, but it's just amazing just to see everyone kind of blow that off there as anxiety on her. Stomach cramping, this is a 14-year-old female. She had gut issues here. Stomach cramping with fever, body aches, headaches, neck was sore. Doing antibiotics for acne issues. Some of those antibiotics created C. diff issues on her. She was treated for that a month ago. She still has issues and cramping and some of the symptoms. I go, this C. diff is still lingering in you. I'm like, they still haven't cleared this stuff out of you. I had put her on our stuff, reload her gut with some good germ. I'm seeing more MRSA, more C. diff, more of this hospital-induced infections are trickling in our office. This stuff is no joke. I had a female patient last month that just turned septic from a C. diff infection and died in a hospital, early 50s. 4 or 5 days turned septic from this stuff. Antibiotics from taking that for a pneumonia completely went downhill with her. This stuff is no joke. After maybe a few weeks here with this, it was about 3-4 weeks there, her stomach cramps and all that stuff, you know, completely disappeared. But she was still lingering that infection in her. What's the point of this? What's this got to do with the female lecture here tonight? All your urinary tract infections, bladder infections, kidney infections, they're being completely mismanaged here. It's an absolute joke. Recurrent infections, you got to ask a few things. Urine pH, 5.0 to 6.5 is what it should be. If you're running a little alkaline, and I could tell the ones who are going to run more alkaline because some of these women will be prone to, you know, issues with kidney stones because you need acid to assimilate calcium. If you're not assimilating your calcium, it builds up in your urinary tract, you get kidney stones. That'd be more of the pH component. If you're too alkaline, that infection keeps coming back. Cranberries, one of the big reasons that people jump to using that for infections because it has a pH balancing property and anti-E. coli, anti-staph properties to it. The germ, you take antibiotics and you keep doing antibiotics for the same infection throughout the year, you disrupt the germ. You don't only have good germ on your gut, you got it all over your urinary tract. You got to put the right germ, and most of these probiotics don't have the specific germ for your urinary and kidney tract there. The primary infections, mismanaged, they don't kill it all the way, it keeps coming back. Sometimes they create a secondary infection, put some yeast in there, or create a superbug infection. Now, individuals coming from the hospital who have been catheterized, I always question the superbug infection. We're seeing more of this stuff turning into interstitial cystitis type problems. This is your MRSA, your C. diff. This is that strong ureter infection from the hospital that they're creating that sits in your bladder, and you never get over this stuff, and they completely mismanage that. There's a secret to this whole thing here too, especially my women who have pelvic pain issues. This book here, A Headache in the Pelvis, completely addresses what everyone else is missing, even when we're not getting responses that we're looking for with our patients with females having chronic pelvic pain. Because you're going between a urologist and a GI doctor trying to find out where this pelvic pain is coming from. This book here addresses the emotional component that people are burdening in their pelvis, creating this pain. This just isn't females. One of my male patients that was having chronic pelvic pain went all the way to California to meet this doctor in person to have his treatments done, and he's using trigger points in his pelvic area to help relieve his pain when everyone was thinking this thing was an infection. There's people who could stress themselves out so much that they get an ulcer. There's other people chiropractically stress themselves out and they're all tight up in their neck and stuck and everything. There's other individuals that get so stressed out and they burden all their emotion down in their pelvis. This is what addresses what everyone else is missing. I've got some pretty cool stories about probably about 4 patients. I'm getting great results with that. I had to refer out that we weren't getting results with that. I knew it was more of this emotional thing that was hitting their bladder than it was anything else. Is it my hormones? I feel bad for the women. It's always your hormones because you're female. Whatever problem you're having, it's always your hormones. No doubt about it, it's always your hormones. Apprehension, depression, inability to concentrate, short attention span, craving for sweets and chocolate, always your hormones. Unrealistic fears, all these things. Look at this stuff. Is this hormone related? No. This is all blood sugar problems here. Your moods follow your blood sugar here. And people who have alcohol, diabetic relatives will be more prone to these things because your pancreas has a harder time keeping up in the blood sugar fluctuations. You got to be a little bit more stronger on your protein components. Had a guy he was a complete to the T hypoglycemic new patient today. They're trying to treat him like he's got a Zoloft deficiency. He's trying to come off of it. I go, what do you eat for breakfast? Nah, probably skip. Lunch? I didn't even remember to eat lunch today. Like, you're starting at the complete bottom. You're getting anxiety attacks. If I treat you for anxiety, that's still Band-Aid therapy. The problem is you're not controlling your blood sugar. Your moods follow your blood sugar. Brain's half fat, half cholesterol, functions best on a high good fat, good protein diet, period. And we talk about the fat and the protein and how that's essential even with real hormonal issues as we go further in this lecture here. Anyone ever see this show, Naked and Afraid? I don't get hooked on shows much, but I've been very curious watching the show because and I'll tell you why. It's your brain's half fat, half cholesterol going into the blood sugar stuff, talking about this. You can only survive so many days without food. It's amazing how the body breaks down when it doesn't get enough fat and protein in it, and to watch how fast your mind completely starts crashing and how angry these couples get when they're trying to survive 21 days in the woods here. The key thing is they're not trying to survive on twigs and berries. They're trying to find some type of animal protein to satisfy themselves. There was a guy who was a recovering alcoholic drug addict on this show. He had a complete hypoglycemic seizure, and they rushed him to the hospital. And they did an MRI, CAT scan, all his blood work and this. They're like, okay, you can't continue on the show, but all your tests are normal. And I knew right off the bat, tracking back to the show, he said he's a recovering alcoholic. He's got a weaker pancreas, needs more protein to stabilize his blood sugar tanked that night, start shaking and having a seizure-like activity, and they completely thought this was a real seizure when it was more of a hypoglycemic attack. They completely proved it, going to the hospital, and they found nothing. They all missed it. It was just interesting here. But here's the key thing. You could survive 3 minutes without air, 3 hours without warmth before hypothermia kicks in, 3 days without water, 3 weeks without food. They're not searching for twigs and berries. They're trying to find protein sources to survive on. Watched it enough so if I ever get lost in the woods, I'm definitely going to be surviving there. Is it my hormones? Everyone thinks acne issues are hormone related here too. I treat most of these like subclinical staph infections, but yeah, you got to address insulin resistance, which is a hormonal component, zinc deficiencies, hypochlorhydria, which is low stomach acid issues, vitamin A, E deficiencies, testosterone problems, estrogen, lack of the germ in the bowels there, yeast, food allergies. All those things have to be addressed, and sometimes it's like kind of peeling an onion apart to kind of get to the core there. But 80% of these people, I'm going to go after this as a bacterial component here. I had a case here just a few months ago. This was pretty good here. 19-year-old female. She's skinny as a pole. They're trying to tell her that she's got insulin-related type problems here. I'm just looking at her. I'm like, and she was doing the Accutane in the past here. Oh, they are completely mismanaging and missing all this stuff here. And, you know, she had some chronic bladder infections there, so that kind of told me about some germ and low hydrochloric acid issues, and maybe that would correlate some of these pieces of the puzzles all kind of matched together here with the acne and that. And I was just laughing because I'm like, I'm looking at her, I'm like, you're skinny as a pole. They're trying to tell you you're insulin resistance. I'm like, this is unbelievable. I'll show you the blood work you want to look at if insulin is what you suspect. And she just called a few weeks ago. She's like 80% better in 1 month treating her acne, and she's been dealing with that for years. So when I talk about hormones here, we're kind of going to go down the line here. I'm going to show you pathways. I'm going to show you why no one wants to talk to you guys about hormones, why some of the stuff gets confusing. I'm going to try to break this up as simple as I can. And so, guys, I'll give you some tidbits here too along the way here. But the pineal gland secretes melatonin. That helps you sleep here. I'm not worried about that there. We're going to talk more about that pituitary gland, the hypothalamus, pituitary gland. Just think brain. We talk about the thyroid. We're going to talk about the adrenal glands. We're already mentioned a little bit about the pancreas there and the blood sugar components. Then we'll go south, talk about the ovaries and all the fun stuff. Maybe if we get exciting, we'll talk about some vaginal yeast issues and all that stuff there too or something. So let's talk about the pituitary gland here. You got 2 hormones that are secreted in the posterior part and about 6 in the front there. Any issues with off balances of these hormones are a primary pituitary issue, most likely here. And what we see in the office, pituitary gland problems, lack of growth in children, migraines around your periods are pituitary problems, stomach ulcers, secondary thyroid problems, and I'll explain that a little bit further on here, and pituitary tumors. What's a pituitary tumor look on someone? Right there. Secrete more growth hormone than you should, and that's what you call giantism right there. It's more of a hyper pituitary problem here. All right, your thyroid. Thyroid hormones have profound effects on many physiological processes such as development, growth, and metabolism. T4, T3, calcitonin. Just know that 3 hormones are released from there. Don't have to get too complicated. I'm more keyed about the bottom stuff here. We went from talking to the pituitary gland. The pituitary talks to your thyroid. Your TSH, ideally your TSH should be 0.45 to 4.5. If you exhibit hypothyroid symptoms, your TSH is below 2.0, it's a primary pituitary problem and a secondary thyroid issue. So some people think, oh, I got the hypothyroid symptoms, but my blood work shows something completely different than a more hyperthyroid or under 2.0. That means that your pituitary is not talking to your thyroid properly. You need to address your pituitary first before really attacking the thyroid here. That's the key point I want you to get out of that slide there. Now here's the pathways here, your hypothalamus pituitary. Just think of that brain and brain. Your brain talks to your thyroid gland, which releases T4, which goes down to reverse T3 to T3, reverse T3 and regular T3 there. I just want to show you pathways here. I know it could get confusing here, but there's some intermediates in this pathway and deficiencies that I got to talk about here for you to understand why your thyroid might not properly be working optimally here. This is from Functional Medicine University, the curriculum I use. These are all the intermediate factors, and this is what I need to do another lecture on, specific just for thyroid function alone, so I can really get more involved with this, of all the different things that will affect your thyroid problems here. Gastrointestinal dysfunctions, candida infections, gluten intolerance will offset your thyroid. Environmental factors, the halogens, I'll talk about that, the PCBs, the chlorines, estrogens, hormonal imbalance, insulin problems, cortisol stuff will shut off your thyroid. Nutritional factors, talking about deficiencies like selenium, iodine, iron. Immune dysfunctions, I've seen viruses attack thyroids and throw those off there. That's got to be addressed. Oxidative stress, and then the detoxification component goes back to the estrogen stuff. Environmental estrogens could offset your thyroid function. I'll talk about that on another slide here too. So hypothyroid symptoms, depression, difficulty losing weight, dry skin, headaches, fatigue, memory problems, menstrual problems, recurrent infections, sensitivity to cold, increased blood lipids there. Morning energy is your thyroid. Afternoon energy, your second win, is your adrenals. You got to balance your adrenal and your thyroid together. Hypothyroid symptoms can mirror image hypoadrenal gland symptoms. That's very important to know here, because here's your adrenal glands: hypoglycemia, low blood pressure, falls asleep but doesn't stay asleep, fatigue, chronic illness, dizziness from sitting to standing, craving salt, irregular cycles, infertility, allergies. These are all your hypoadrenal gland symptoms. Your adrenals are your second win. More commonly, the dizziness from sitting to standing is what we see a lot of, and right now the allergy patients right now with the adrenal components here. Got to work on them both. Now here's a confusing fact slide here. Don't get confused, I'm going to explain it. Your pituitary talks to your thyroid. Your thyroid releases T4 down into these intermediates to work with your metabolism. Out of this slide, I just want you to see selenium, iodine, selenium, iodine, iodine, selenium. Those are all cofactors to make your thyroid function properly, optimally here. Selenium deficiency. You get the thyroid that releases T4, which releases T3, which has the effects on the body. And you need selenium for these intermediates to connect here. Deficiencies of selenium compromise immunity, cardiovascular health, inflammation, cancer issues should be up here too. Low selenium levels associated with diminished deiodization of the T4 and T3. Consider deficiency of total T3 is reduced and or T3 is reduced with normal TSH levels and T4. High thyroid antibodies. If something's attacking your thyroid, it's a component with a selenium deficiency also. Like Hashimoto's. This is an autoimmune disease where lymphocytes, your body's attacking normal healthy tissue. And that's where you'll get the high thyroid antibodies up here. And a lot of these individuals will have gluten intolerance. Only 2% of the population will have what we call a goiter up here. Hashimoto's disease and parvovirus. Parvovirus 19 detected in 91% of Hashimoto's subjects with the PCR testing compared with 44% of normal thyroid tissue. Viruses attack normal tissue. This is something that you got to be aware of, especially if you've got a viral tendency. Arginine foods and high in arginine will irritate a viral person. You'll go through your family history or your own history of how you developed through your child life and infections that you've been prone to to know if you're a viral person. Some people go back and forth, some are more bacterial, some are more viral, some go back and forth or get mismanaged and deal with the fungal yeast issues or suppress your immune system and deal with worse things here. This is a female patient. She lives out in Milford here, real nice lady. She had a lump in her throat, painful to swallow, painful enlarged thyroid, had an ultrasound blood work the other day. Racing heart. She had, and her heart rate was about 110. She was exhibiting all hyperthyroid symptoms. She was muscle testing for a virus. They want to take her thyroid out. I go, I would hold back. I think they're being a little too aggressive. I want to treat this like a thyroid, like a virus attacking your thyroid here. And I saved her thyroid. This was 1 week later. Her pulse came all the way down to 84. She did a steroid shot just for some symptoms, manic relief with the swelling there. But her blood work showed the TSH was hyper. It had an overactive thyroid going on from the virus attacking it. And her thyroid antibodies were up, confirming something was attacking her thyroid. Without her having to get her thyroid taken out and treating it like a virus, she saved her thyroid here. It was very cool. Iodine deficiency. Iodine deficiency is a problem worldwide, mainly due to the soil depletion. Iodine deficiencies are a leading cause of preventable mental retardation worldwide. Symptoms down here: subclinical thyroid, weight gain, fatigue, goiter, cancer, fibrocystic breasts, impaired mental function. Lumpy, bumpy, cystic, painful breasts. Iodine deficiencies. Dr. Brownstein will say 95% of all his patients are iodine deficient who come in his office that he's checking for it with because it's not in the food, soil, and water here. I just put up, and a lot of people are pushing iodine out of their system before 10 o'clock comes around the corner. Wake up in the morning, take a shower in the chlorinated water, brush your teeth with some fluoride, and you're pushing iodine, if you have much iodine, out of your system here. Switch over to a $37, $40 dechlorinator head unit for your shower. Women will love this. The first time you use this, my wife said, I'm putting my comb through my hair, and I don't have knots. My comb's going through my hair very easily. Your skin will feel different on that. For $37, $40, you can make a huge difference by just getting a filter to take some of the junk out of the water while you're showering there. Halogens. These are all your fluoride, chlorine, bromide. If any of these three things are present around iodine, these will win in the battle. So fluoride pushes iodine out of you, chlorine pushes iodine out of you, bromide pushes iodine out of you. It's as simple as that. Eliminate those factors. If you got thyroid dysfunction, you gotta be with a doctor who knows how to play iodine properly with you. And there's issues with patients that have symptoms with doing too much iodine. That could be an issue underlying selenium deficiency. So you gotta know which direction and all that thyroid chart of all the different things that could affect it, of which angle to take here with this. Breaking down the labs. So your pituitary talks to your thyroid there through the thyroid stimulating hormone to release thyroid and T4. To release that intermediate between TSH and thyroid, you need iodine and tyrosine. Those are the two intermediates. If you're deficient on that, you'll have a hard time converting that there. Iodine deficiency, increased TSH on blood work, decreased free T4, increased free T3. That's how you see it on the blood work here. Let's get into some more fun stuff. The female endocrine system, one of the most complex body systems to access and treat is the reproductive hormone system due to the interconnection with other hormones, namely the adrenal and the thyroid. Got to balance the adrenal and thyroid out. This is very important with anything as we go further here. There's also issues of environmental toxicity, nutritional influences and deficiencies, hormone metabolism, detoxification of other hormones and their metabolites when considering these things. Now go to the bottom here. All steroid hormones are derived from cholesterol. You need cholesterol for your hormones here, and this is important as I get into some further slides here, and I'm going to explain this to you here. You got to balance the majors first. Adrenaline, cortisol, insulin. When addressing anything hormone related, this is where you start at. You got to address the major ones first because these will throw off everything else here. You increase your cortisol, your blood sugar shoots up, your insulin shoots up, then you create this dysinsulinemia and this pre-diabetic factor here. Now this is going to confuse you, but you got to visually follow me on this one here. Acetyl-CoA, this is cholesterol. Just imagine this is cholesterol that converts down to pregnenolone, that goes to progesterone, down to cortisol. This pathway also goes down to DHEA, down to, let's make it easy, testosterone and estrogen. If you're chronically stressed out, you're going to push this pathway down to your cortisol pathway. And you're going to create imbalances and deficiencies, low DHEA, low estrogen, low testosterone issues on this. Here's your secret for the guys. Guys will have crappy sex drives under stressful times because they're pushing this pathway all the time with their cortisol, and they shut down this pathway of testosterone. Who do I not want to deal with hormonal issues? Anyone on statin medications, because right off the bat, you're lowering your cholesterol. This is a building block for everything here. You lower your cholesterol, you're going to screw up this whole pathway here, and that's why being on cholesterol medications, a guy's sex drive, boom, shuts off like that. Vegans, vegetarians sometimes don't get enough of the building blocks and cholesterol components for those things here too. And I see a lot of other integrative practitioners will go right to using pregnenolone supplementation with them because of that problem here. Those are tough to deal with when you don't have those intermediates and those building blocks to get to the next step here. But we're going back between insulin, cortisol. Those are the main two that you got to balance. You got to balance the major. So I'll go back to this chart a little bit further on when I talk about progesterone and estrogen issues here. Normal cortisol levels are elevated first thing in the morning here, and they tank as you go through the day. You want them low at night so you could fall asleep at night. My individuals that have a harder time falling asleep at night tend to have issues with cortisol here. The cortisol is up, it throws everything else off there. My individuals that don't have enough cortisol when they first wake up in the morning, they love their stimulants. They love their caffeine, their coffee. I can't get going, the McDonald's commercials, I have my coffee type thing, because they're trying to push that cortisol up with stimulants to get the cortisol where it should be around those times here. Cortisol is absolutely a huge component, and especially with weight issues and people who are struggling to lose certain weight there. Cortisol, the DHEA ratio should be about 5.1 to 6.1 there. Signs and symptoms of high cortisol: difficulty losing weight, frequent colds, frequent infections, sleep problems, more of the harder times falling asleep issue. Hard time staying asleep is more of the sugar handling component there. Now, your thyroid, here's your thyroid adrenal connection here. High cortisol, you shut your thyroid down. Your pituitary talks to your thyroid. If you have high cortisol, and it inhibits the pituitary to thyroid. Same thing down here, thyroid to release the free T3, cortisol inhibits that. You have high cortisol issues, you'll shut off your thyroid there. So insulin resistance here. Insulin resistance and hyperinsulinemia are associated with the increased risk of cardiovascular disease, obesity, non-alcoholic fatty liver disease there, breast cancers. This is increased uric acid in the blood here, and all the polycystic ovarian syndrome. Insulin problems create hormonal imbalances here. Gotta address the majors. Absolutely gotta address the majors. How do you know if you're insulin resistant? This is how you define insulin resistance here. If you don't catch everything on here, we're gonna have this on YouTube and on the videos and that stuff, and I got it at the office here. On your blood work, high cholesterol, low HDL, high LDL, increased triglycerides there, increased glucose, hemoglobin A1C, insulin. Those are out of range. Those are some type of component to insulin resistant type problems. Stress goes up, cortisol goes up, blood sugar goes up, creates insulin problems. You turn insulin resistance, metabolic syndrome, maybe diabetic, pre-diabetic, obesity, hormonal imbalances, excessive LH, FSH, and then you run into these types of problems. Issues with ovulation, infertility, acne, period problems, and right down there. So that's how this kind of throws off those imbalances, and that's why you got to address the majors first instead of just attacking the symptomatic components with this. Here's the issues and why we're running into a lot of these problems with the insulin component. This is how we live on a daily basis. You break down proteins, carbs, fats. The standard American diet is so fed up with sugars and sugars and sugars and sugars that we kill this pathway here, and you need insulin to get the glucose into the cells to produce energy, that you create this insulin resistant problem because you're burning out your insulin cells with too much sugar. High protein, low sugar diets have always kept people trim and clean. I like doing a paleo style diet there. Some of you guys may have seen my little mini lectures at the office there, and I break down why everything kind of works with that when you cut out your sugars, your grains, and your dairy component here. Fertility and your thyroid here. Thyroid range is 0.45 to 4.5, ideally 1.0. People can still have a subclinical thyroid issue if you run 2.0 to 4.5 at the high end of normal. That's a subclinical thyroid issue. That could be an iodine deficiency or something that you have to play it with a little bit more aggressively here. This is important here because at that higher end of normal, that doubles miscarriage rates here. Very key to look at with young females here. Xenoestrogens. This is wreaking havoc on everyone in this room. Xenoestrogens are man-made substances that are foreign to the body and have hormone-like effects. Most of them act as estrogen and hop on these receptors just like estrogen does and create problems here. Infertility in both sexes, decreased sperm count, estrogen dominance, cancers, and weight problems. Breast cancers, xenoestrogens. Prostate cancers, xenoestrogens. Infertility, low sperm counts, xenoestrogens. Gender bending issues with the young kids, fender bending. Issues with xenoestrogens. I've got, individuals, 15 years old, young males growing breasts. I got younger females going through puberty earlier and earlier because of the environmental effects of this right here. If your detox pathways aren't opening, you're not clearing this stuff out, you're going to have problems with this. And you can't live in a bubble, but the food, water, and air, we're all getting hit with these types of things here. And this could throw off a female's hormonal pathway and push a female more estrogen dominant here. Common sources of xenoestrogens, synthetic estrogens and medications, plastics, pesticides, herbicides, fungicides, PCBs, chlorine solvents, your birth control, traditional hormone replacement therapy stuff, all these things are estrogens. If you think organic food is expensive, you haven't priced cancer lately. This is such a true statement here. Environmental Working Group. These are babies here. Of 10 babies born in the U.S. hospitals, 287 chemical compounds identified in their cord blood, an average of 200 chemicals per infant. Your kids don't even stand a chance today. Do you think these chemicals have estrogen-like effect? You absolutely believe they do, without a question of a doubt here. If you want to check out more on the toxic world stuff there, I've got that on DVD and it's also on YouTube. Before someone kicks us off YouTube for saying things and spreading truth around, suggest you get a few DVDs once in a while. Got milk. You probably got estrogen, both on growth factor, steroids, antibiotics, and all this stuff too. If you have weight issues, first thing I do is cut people off dairy. It is so growth promoting. There's nothing in there that you will lose weight doing dairy today. Understand the calcium milk. Well, the calcium myth. If I don't drink milk, where am I going to get my calcium? This is why I always had earaches growing up my entire life. Pound me full of milk, full of mucus, got the earaches and the sore throats and a strep throat going on. Antibiotic year after year for the same infection. But where are you going to get strong bones if you don't drink your milk? You need other cofactors. A lot of people are getting crummy sources of calcium here too. Coral calcium, oyster shell, calcium carbonate. How do I know if a product's cheap? I look for calcium carbonate under the ingredients. If it's got that in there, they're using cheap things That calcium builds up in your muscles, makes you stiff, builds up in your joints, or builds up in your muscles, gives you cramps, joints, stiffness, kidneys, kidney stones, gallbladder, gallstones, heel spurs, back, neck, arthritis. I get aches and pains out of people just by getting them off crappy calcium. Some simple stuff with some patients, but you need other nutrients for your body to absorb calcium, magnesium, the K2, the D3, silica, and your essential fatty acids. Proper pH is huge. If you don't have enough good stomach acid to assimilate your calcium, you don't even utilize what you take. And as you get older, your stomach acid kind of decreases, so you need more help in that direction there. Osteoporosis involves the weakening of the bone matrix, and then demineralization could begin in women as often as early in their mid-30s. Things that will lead to this: antacids, poor nutrition during puberty, lack of exercise, smoking, hormonal imbalances. Medications that will destroy your bones: antacids, anticonvulsant drugs, antidepressants, sedatives, sleeping pills, warfarin, Coumadin. Antacids completely turn off your stomach. You won't absorb your minerals to feed your bones. You don't absorb B12. You don't break down your proteins, and you turn off your immune system to your stomach. You take antacids for at least 10 years, and I will be able to see osteoporosis on someone's x-rays that's induced from that period. All the older folks who are losing too much calcium and stuff, and they're walking around and they're hunched over, they're losing it from their spine, and their body's crumpling apart because they're not getting enough to feed their bones. You go through puberty and you're missing your minerals. The girls and people get scoliosis, all minerals. A guy with kyphosis today, big hunchback, same thing, that's all mineral deficiencies there. Coumadin here. Those with the lowest vitamin K intake had a 65% greater risk of suffering a hip fracture. You limit your vitamin K intake, you don't utilize your calcium, you'll be prone to hip fracture there. I got a patient right now that she's battling C. diff issues. I'm trying to clean her out of this stuff, and she's pooping blood through her intestine because she's on so much Coumadin. She's bleeding through her intestines, and they had to cut out her Coumadin. Take that long term, weaken your bones, slip, fall in your 80s. That's not fun dealing with a broken hip. Sometimes that could be life-threatening with some patients there. Your anti-osteoporosis medications here. Increases femur fractures after 5 years of taking them. It shows better bone scans, bone tests. Such a joke to sell these types of medication here. Your bones need nutrients. It's like if you have a plant here, you can't give it synthetic medications and hope the plant grows. It needs nutrients to grow. So the same thing with your bones. It's as simple as that. Lactose intolerance and cancer. Now, when you talk about issues with ovarian cancers, breast cancers, cut out the dairy. Especially the ovarian cancer, women tend to have lactose intolerance, not lactose, but galactose, where they can't break down the galactose, and it irritates those ovaries and could stir people and push them into the ovarian cancer realm. That was a family history. Grandma and mom had issues with that. The first thing you do, goodbye dairy. Mammograms. A study published in the New England Journal of Medicine indicated that X-ray mammogram study saved one person for every 2,500 screened there. More and more evidence are showing these really aren't as effective as people are thinking they are. This was for my cancer lecture here. If you're thinking and you want preventative measures minus the radiation, thermoscan's the way to go. It measures heat thermography off the breast. If there's a cancerous spot or lesion, it's highly metabolic, more blood flow goes to it, more blood flow, you'll see it on the scan there. This is what a typical scan kind of looks like here. And the women love it because they're not getting a dose of radiation year after year to go after something preventative here. We're not anti-mammograms. If something pops up here and we need to further investigate things, we'll recommend that, but we're not for it as a preventative way. We'd rather go this route here with our patients. The cancer killers, that's on YouTube and that's on disc there too. That was part of that lecture. Ovarian cysts are extremely common, often resolve on their own, and are almost always benign. Ovarian cysts are products of failed disordered ovulation there. This is from Janet Lay. I took some of her stuff here. predisposing factors here: estrogen dominance, iodine deficiency, insulin resistance, especially with the polycystic ovarian syndrome here. That goes back to the insulin stuff, high insulin throwing off the hormone compounds there. So you gotta go back to balancing the majors. It goes back to going to those majors there. Menstrual cramps, and yes, there's some normal severity to cramps here, but my more severe cramps sometimes have underlying issues with calcium deficiencies, magnesium deficiency, essential fatty acid deficiencies, estrogen dominance, progesterone deficiency, endometriosis also, and I'll talk about that coming up here too. Endometriosis here is a condition in which endometrial tissue, you can kind of see on this diagram here, kind of spreads around here, grows inside the uterus there, and depending where it grows will cause different kind of symptoms there, and there's different severities, and it's unique because typically it will go away after you've had a kid. There's some unique cases after you have a kid that it could kind of come back there, but normally after having children it goes away there. But it'll cause pelvic pain, inflammation, bloating, abdominal bleeding, cramps, PMS, infertility, back pain. These can be a little bit tricky to treat here, but you really got to do a diagnostic study with the hormone components to go after that here. Fibroids are tough fibrous lumps that arise from the uterine muscle and connective tissue. You can see from the diagram here where they kind of develop. If they're big enough, we could see things like this on x-ray. We just saw one last week on a female's x-ray there that she had fibroid just growing in her uterus there. Most remain benign. Fibroids can cause infertility. Estrogen dominance will make them grow. Common causes for having a hysterectomy. The majority of the fibroids do not cause any real problem and may need no treatment at all. Key thing to kind of understand there. Some of these get mismanaged and pushed down the wrong route here. Estrogen dominance, a condition in which women can have a deficiency, a normal or excessive level of estrogen in their system here. Symptoms, causes, stress, exogenous estrogen, bisphenol A. Plastics mimic estrogen. Adrenal fatigue, nutritional deficiencies, birth control, hormone replacement therapy. The majority of the time we're going to see a lot of issues with estrogen dominance. Women could tell with their periods who are more estrogen dominant. Heavy flow, heavy bleeding. This stuff tends to be more issues with estrogen dominance. And I'll go back to the chart, the diagram, talk about progesterone and estrogen because they have an inverse relationship with each other here. Estrogen dominant symptoms. Are you retaining water? No, you're retaining food. That's what we want to start telling people. But we can't, I'm just kidding. Bloating, breast tenderness, fibrocystic breast, mood swings, depression, anxiety, anger, headaches. Go down to the ones I have in bold that you'll see here, the fibroids, polycystic ovarian syndrome, endometriosis, infertility, all these things, estrogen dominant symptoms here. Progesterone. Progesterone is a steroid hormone produced in the ovaries and adrenal glands, and one of the main roles is estrogen balance here. Protects our uterine lining, bone growth, sex drive, precursor for other steroid hormones, and protects you against certain cancers here. Very important hormone here. Symptoms of progesterone deficiency kind of mimic estrogen dominance here. A lot of the same things here, because if you're deficient, more estrogen, low progesterone on the side here. So let's go back to this chart here. Break it down easy. Let's make this easy. You got cholesterol here, you got progesterone here, you got estrogen down here. If you're estrogen dominant, you're going more down this pathway, which decreases this but increases the estrogen here. All this exogenous estrogen, environmental stuff, pushes more of this and decreases the progesterone. Like I said, vegans, vegetarians, people on statins, you need building blocks for this sex hormone pathway, period. Stressed out people are going to be pushing down the cortisol pathway and robbing this pathway. So that's just kind of just going back to those charts here. Menopause is a normal stage in a woman's life in which she ceases to have any menstrual periods there. It's defined with no periods that have occurred 12 consecutive months here. Symptoms, hot flashes, night sweats, insomnia, vaginal dryness, mood swings, weight gain, decreased sex drive, urinary bladder issues, kind of on that one here too. Menopause. This is completely normal here. This is what gives guys hot flashes right here. Hysterectomy is the surgical removal of the uterus. It may also involve removal of the cervix, ovaries, fallopian tubes, and other surrounding structures there. Key points to understand: 90% are elective, and for non-life-threatening reasons like the fibroids that we're talking about or the heavy bleeding there. Consider having a partial hysterectomy over full, which leaves the cervix intact there. Surgical menopause is removal of the ovaries there. So I'm leaning into talk about hormonal components and things to use here, especially the hot flashes here, which are a common symptom of people who are premenopause or in menopause. Treatments: bioidenticals, hormone replacement therapy. Pros and cons, pros and cons. Pros to bioidentical hormones: closely mimic human hormones in the structure and function, few side effects, more effective than synthetic counterparts, increased efficiency when used in combination. Traditional hormone replacement therapy symptoms: heart attack, stroke, cancer. You want the bioidentical versus the synthetic form if you could go that route. Absolutely. Compounding pharmacies, we use some products at our office and get some good results there with them, but you definitely want more of a plant-based component than the synthetics. Premarin, this is conjugated estrogens here. Premarin is conjugated estrogens from mare's urine. This is female horse urine. It's for horses, not humans. These are some of the side effects. This is the stuff right here. This is what women are putting inside themselves. How does this stuff sound? Absolutely rethink your decisions and what you're putting inside yourself here. And they want everyone to run around in circles supporting breast cancer during October and this kind of stuff, and all these cancer runs during the summer. They're spreading this stuff. Birth control, hormone replacement therapy, all this environmental estrogen. This is where this stuff's coming from. It's not rocket science here. Dr. Oz. We all love to hate Doc. We love to love him and love to hate him at the same time. He annoys the alternative guys, and he annoys the traditional guys. He plays both sides of the fence. He just needs to pick one side there. I love to see who watches too much TV, because I'll get asked Dr. Oz questions on the office. What about raspberry ketones, Dr. Jeff? I heard Dr. Oz say that was good. You could kind of tell what sells good here with him, because he's been talking, you know, anything I've ever seen from it seems to be weight-related stuff here. Well, here's the key thing. Where do you park your fat? How do you know which direction to go through? Weight thing's not a one-pill thing here. When you look at this here, your triceps, you got more fat in your triceps. It's an insulin issue or low DHA. If it's in your chest or hips, it's your estrogen component. Stomachs, this is your cortisol. This is your insulin component. You got to know where you park the fat at to know what you're going after here. I address a little bit more of that in my Sports Nutrition Top 20 Exercise Myths DVD. That's also on YouTube there. Medications that will make you gain weight: birth control pills, steroids, antidepressants, estrogen, antibiotics. You're trying to lose any weight and you're on any one of those, good luck. Here's the key thing. This is the whole key of the whole lecture. How do you optimize your hormone levels? Clear the exogenous estrogens out of your system. You want your pathways open. You got to balance the major hormones first. Adrenaline, cortisol, insulin, period. You got to address the majors there. If you want to address this a little bit more further in depth here with me at the office, I will run the blood panel for the insulin resistance stuff for $160 here. Look at those factors. I use Genova Diagnostics. If you think cortisol DHEA is an issue here with you, I'll do a saliva test here with you, which will address that. A lot of times I just jump right into the cortisol issue without checking for that, because there's a lot of symptoms and things that will draw me towards that and knowing if I have to go in that direction. Genova Diagnostic, if you want to get further into your hormones and very much more in depth. The Rhythm Plus panel here is fun to run. $139, and this is 16 saliva samples collected over a 28-day cycle. These are all the hormone components that this checks here. You pay $139 and you use your insurance pays the rest. Most insurances cover it, and you pay the $139. What's not covered, Genova Diagnostic bites the rest. They don't charge you more. So all these integrative MDs running these expensive panels, I could run the same stuff and get great prices doing them here too, and they won't keep billing you more and more if your insurance won't cover that. It's kind of cool. Ask at the office about that. Make an office visit, customize a protocol for you. New patients, you want 25% off. I'll hand these around. Online ordering through the website. Thanks for coming out tonight. Questions, comments, concerns, you can send it to I don't really give a crap at gmail.com. I'm just kidding. There's my email right there.